Hi, what's up? This is RJ Sheetal, and welcome back to Fever 104 FM. I have with me someone really special. In fact, I did go to her clinic and get a nice glow up done. It's none other than Dr. Karishma. We are celebrating World Plastic Surgery Day, right? Dr. Karishma, thank you so much for being a part of this and welcome to Fever 104 FM.
Thank you so much, Sheetal. Really nice to see you again. It's been a while. And
It's been
happy
a
to
while.
be on Fever 104 on World Plastic Surgery Day, which is celebrated every year on July 15th.
Absolutely. And as a doctor, how do you feel? What are your emotions on this day? You feel happy? You want to tell something to the entire world?
Well, of course, I'm a proud plastic surgeon. I'm so happy and proud to be in this fraternity. And it gives us deep satisfaction as plastic surgeons to be able to be changing lives each and every
Right.
day. Not many people know out there that plastic surgery is, defined in toto by plastic reconstruction and cosmetic surgery. So
Right.
even though I perform predominantly more cosmetic surgeries, but I also do perform reconstructive surgeries. So, plastic surgery is a culmination of reconstruction, trauma, as well as aesthetic surgery. And today's day is all about, letting the world know what plastic surgeons do each and every day, making people a better version of themselves and changing lives, whether it's reconstruction, but at the same time, also giving them the aesthetic touch. Imagine with every reconstructive procedure, there is still some amount of aesthetics involved. I
Yeah.
mean, it could be even burn surgery for
Hmm.
burn victims. And again, it is all about doing something better for each and every person. And I think every plastic surgeon across the world wants to put it out there to
Right.
everyone who are unaware of. What plastic surgery is all about, and that it's
Right.
so much more, but it's spoken less about.
Yes, absolutely. And in fact, I feel that the perception about plastic surgery is different, right? It was different back in the days, and over the years, it has evolved. And what do you feel that the role that the World Plastic Surgery Day plays in promoting a positive understanding of the field? Because usually the perception is a little on the negative side. So, what's your take on that?
So the plastic surgery is a very dynamic and evolving profession, and people are very misjudged about it because the glitches are only about aesthetic surgery. Only when
Right.
it comes to cosmetic surgery does things come out into the media and get totally haywire about it. But I think people should know that in fact plastic surgery, the beginnings of plastic surgery have their roots in India itself. It was
Right.
Shushruta in 600 BC who performed one of the first reconstructions on the face and on
Right.
the nose. So even in the international textbooks, India, Shushruta is mentioned because the beginnings of plastic surgery were right here in India. So
Right.
this is where the roots are, and that is how old plastic surgery is. For those who do not know, plastic surgery started way back in World War One and World War Two, where there were deformities. There were war veterans who came back with severe burn injuries. They came with facial traumas, bony traumas, and it was those surgeons then who started the reconstructive process.
Right.
We may talk about doing a face or a nose job now.
Yeah.
Noses were reconstructed then, but also to give person an aesthetic nose, because finally,
Right.
even if we reconstruct the nose, the person does want to live with a good looking nose.
Of course.
So I think we want to create this awareness on this day that plastic surgery is not just a bad
Right.
procedure done wrong or a botched up job. There is so
Mhm.
much to plastic surgery because all of us are working each and every day to bring a smile on someone's face no matter what, and that is a final intention that I want to get out there. And the positive vibe that plastic surgery has, it's not just a bad nose job.
Right.
It's not always a bad. I mean, there are millions of amazing plastic surgeons doing amazing work out there. So I'm a very
Absolutely.
proud plastic surgeon, and I want to bring the awareness that plastic surgery is one of the super specialty,
Mm.
super specialties that is neglected, and sometimes only the bad and the negativity comes out. But there are so many positives about our
Positive.
profession.
Yeah, absolutely. In fact, can you share some of the insights of the advancements in plastic surgery techniques and technologies that have emerged recently, and how do they contribute to a patient outcomes?
Yes, so as I said, plastic surgery began literally in World War II.
Yeah,
And from then, there are surgeons who dictated certain procedures. Just like science, technology, or
right,
any other field, there is always something new coming up. It's dynamic, it's evolving. And we learn from the previous techniques and we
right.
evolve with new techniques. Just like liposuction, it is more than a 40, 50-year-old procedure. It's not
Procedure,
something new,
yeah,
right? But there was the traditional methods, and now you have the latest technologies in terms of ultrasound, third generation and fourth
right.
generation liposuction devices like the ultrasound laser. You have power liposuction devices. I've recently launched a latest power liposuction called the Vibrosat. What these things do, so as a surgeon, as a doctor, I'm utilizing these used technologies to make things safer for my
Right.
patients. That's the whole idea, finally.
Absolutely. I wanted to ask you one very important question that I feel is needed in this generation. Now you see that there's all this body positivity and people asking others to accept your natural beauty. And I feel like in a way people want to be very raw and real, right? So as a plastic surgeon, how do you find the balance in meeting both the standards, right? Where you're saying that yes, natural beauty is there, but this is also not bad. This is also very good for those who prefer to do it, who like to look a certain way and things like that. So what is your take on this?
So I really, when you ask me this, the first thing I remember is one of the interviews that Sushmita Sen had at
Hmm.
a particular congregation, and I think it was about cosmetics and beauty. And she
Okay.
says this, and I will just quote her, that if you look yourself in the mirror every day and you think you look perfect, then good for you. And
Right.
that's amazing. And it's always good to be happy with oneself internally as well as externally. But if you feel that you need something that needs to be modified, or maybe redefined, or
Right.
maybe rejuvenated, or
Yeah.
maybe refreshed, any of
Right.
this, then why not go ahead and do it? I think plastic surgery is not something that someone should tell you to do it. It's a
Mm.
personal desire.
Personal.
It is something that you must know that you want for yourself and not someone telling you. So, and when it comes to natural beauty, yes, the whole world is raging about use natural and do it. But so we as plastic surgeons recently also have been meeting, in conferences, and we discuss with plastic surgeons from across the globe when
Right.
we meet at these meetings, and we have all been realizing how do we make our procedures look natural. So
Natural.
that is
Right.
where our evolution come, and we are becoming dynamic with the procedures, whether it's a lip filler, whether it's a Botox. When my client tells me that I want to do it naturally, I make sure I do it in moderation. So, whichever procedure is done in a rhinoplasty, you need to respect the ethnicity and do it such that it is harmonious with the rest of
Right.
the features of the face. So, I think you can stay natural with cosmetic surgery, but do it with a board certified plastic surgeon who has experience with that particular surgery, and also can give you that natural looking result, which means it should
Right.
not look too. So don't overdo plastics,
Overdo.
don't
Right.
overdo your aesthetic surgery. And when I have my patients with fillers, I keep telling them do it after 1 year or space the time between.
Right.
Otherwise, when you overdo something, then automatically it's going to start looking artificial. So
Right.
I think we have been also changing ourselves as plastic surgeons. The trend was different in the 80s. People wanted extremely huge breast
Yeah.
implants. Today, it's different. They want moderate. And when I mean natural looking, do a moderate size implant. No one will ever
Right.
say is a breast implant. So it's just that
Absolutely.
we are evolving. Surgeons are evolving with time, trying to do the procedures to our patients in such a way that it looks not too obvious and in your face.
Right. Absolutely. Makes sense. Now, I also know that plastic surgery has a big impact on a person, both emotionally and physically, right? So, would you like to share any case study which talks about, which highlights a transformative change and how it's impacted positively in one's life?
Yeah, so when I started my plastic surgery, even as a resident, what really moved me was working in the burns ward, where I was
Okay.
treating burn victims. And, that is when I realized, even though I'm predominantly an aesthetic surgeon now, when we did these surgeries and rehabilitation for our burn victims, yes, we are looking at giving them functional improvement. Some of them would be burnt all over the face. We would have to do maybe 4 or 5 or even more surgeries, and they know that they may need surgeries the rest of their life to try to get things better. And that is where I saw that we are giving, if a person has burnt the hand or traumatized the hand, as plastic surgeons, we are also hand surgeons. We fix the bones of the hand, we fix the bones of the face. We are into, doing facial-maxillary plastic surgery. There is, at the end of the day, there is this gratitude that we get when you treat them, and they are not just happy because we reconstructed the hand. I mean, you can eat your food after that.
You're back to
We
normal.
lost a
Yeah.
thumb and we put the thumb together. The thumb gives us 50% of our hand function, and even with
Right.
maybe 2 fingers, I can literally do 80% of my job.
Right.
So I believe when I was a reconstructive surgeon, I do less of those procedures now, but there's gratitude because you are changing them functionally. In terms of aesthetic surgery, I think breast reduction surgery is one aspect where women come to me with the functional issues rather than just cosmetic. I mean, they have
Right.
back pains, neck pains,
Yeah.
social embarrassment, there's too much, posture changes, and
Right.
they come to me just saying, take the weight load off my chest.
Yeah.
It's not just cosmetic for me. So I think reconstruction or aesthetic, both of it, there are so many numerous stories I can keep going on. But finally, if we give them what they need, whether it's putting a thumb back in or reconstructing a burnt face, even reconstructing a burnt face, finally we try to make them look pretty as much as we can in
Possible.
our
Right.
limitations.
Right.
So there is the aesthetic part which blends with reconstruction, and that is plastic surgery.
Absolutely. It's World Plastic Surgery Day, right? And I know that it aims to raise awareness about the availability and accessibility of plastic surgery in different parts of India. So, what are some of the initiatives or programs that are being undertaken to ensure that plastic surgery services are accessible to individuals? There is awareness, plus, there's also a financial means to afford them, right? Because these
Yes.
things are expensive. So, what's your take on
So
that?
that is a myth that it is all expensive.
Okay.
It is not. So see, as a plastic surgeon, and the board certification that we receive as a super specialist is just like any other super specialist, like a neurosurgeon, a kidney surgeon, a liver surgeon. We've all done the enough amount of degrees. So I'm sure a heart surgery
Right.
or a liver surgery could be expensive. Let me tell
Expensive.
you, plastic surgery is actually not that much.
Oh, okay. That's, yeah,
But the
probably then.
psychology, our psychology is that I would pay any amount for my brain surgery or my heart surgery, but I do not want to pay when it comes to my body. But this is
Yeah.
also my body, and I'm living in it
Right.
day in and day out, going to show it to the whole world. So I feel people need to believe that a plastic surgeon is a super specialist, like any other super specialty. The cost could matter, but then as plastic surgeons, we are, a lot of us are both certified. So people out there must know, when you're choosing your plastic surgeon, it's highly accessible. In fact, we have our Indian Association of Aesthetic Plastic Surgeons, where we have regular national congresses, conferences, meetings, educational information, where plastic surgeons are meant to keep updating themselves.
Right.
And we are also, our national society is connected to the International Society of Aesthetic Plastic Surgery, called the ISAPS. And this is where we trade knowledge, we trade information, we share our knowledge with each other. And people who need to find a board certified plastic surgeon close to their place, I think they must also know they can find your plastic surgeon on the Indian Association of Aesthetic Plastic Surgeons website, which is called the IAPS. So these are kind of websites which are not just for the surgeons, but we have educational material and awareness for our patients.
Patients, absolutely.
Finally, a board certified surgeon like me, I make sure that I'm always updated and being part of these societies where we further continue to learn,
Right.
not just sharing knowledge. So I continue to learn, keep myself updated. At the same time, we have all the plastic surgeons listed who are board certified on these websites. So a patient can be absolutely rest assured you can find any one of us on the ISAPS or the IAPS website, and they will get a lot of actual true patient information, not just what is you read on Google. I mean, everyone comes and reads on Google. Today, I want to put this forth to the public out there. please go to authentic websites like the ISAPs and the IAPs. You will find your plastic surgeons, and you will find extensive educational information which tells you the truth about the procedures that you want.
Right. Absolutely. Thank you so much, Dr. Karishma. This has been wonderful. In fact, I had so many myths in my mind, and I think like it's been cleared now. So thank you so much for that. One last thing, it's World Plastic Surgery Day, right? So what's that one message or one thing you want to tell all our viewers and listeners today?
I would like to tell all the viewers, please do not have negativity towards plastic surgery. Plastic surgery is a beautiful head to toe profession, and there is so much that we strive each day to give our patients and bring smiles to their place. We try to change lives every day, change structures. We try to do our best so that it is for the betterment, and at the same time bearing in mind the patient's safety. And that personally, that I look forward is always my patient safety and making sure they're taken care of. And so be positive about plastic surgery. We have so much to offer you, head to toe, from a hair transplant to a thumb transplant to a nose job, and burn surgery. We have it all. So trust in us, believe in plastic surgery, find your right plastic surgeon who will help you. Make sure they are both certified and probably part of international or national societies. That is where you know the credibility of the surgeon that you're going to. And I think this is from every plastic surgeon out there. We are proud to be a plastic surgeon. And I'd like to wish all the other plastic surgeons who do watch me a very happy Plastic Surgery Day.
Thank you so much. That's a wrap for my conversation with Dr. Karishma. See you soon.
Bye, Sheetal. See you.
Bye. Thank you so much, doctor.
Thank you.